So Dr. Joe, I'm having trouble and pain in my wrist and my hand because of how I hold my phone and grip my phone like this. I'm having pain from my pinky down my wrist on the outside and the inside, and I just wanted to know, how do we treat it?
If you experience pain from holding your cell phone, this area, wrist extensor comes from your outside of your elbow, lateral epicondyle area, so from here to here. So we gotta treat this muscle here to all the way there. And then if you experience discomfort this side, the front side, then this is a wrist flexor. So it goes to your medial side, medial epicondyle area. We gotta treat these muscles, the wrist flexors. Yeah. Okay, I wrote down the wrist flexor, this muscle, wrist flexor, the inside of your elbow, medial epicondyle, and the wrist flexor insertion is here, and it goes all the way towards your wrist. If you keep overusing it, keep overusing your wrist flexors, then the muscle condition is getting poor, and then it eventually creating some muscle knot. It's called the trigger point. This muscle trigger point is pulling your muscle tension. You feel the little pressure there. So if you form the tight, strong trigger point here, that can cause a little referring sensation down towards your wrist, because these trigger points keep pulling towards this direction. So we gotta first of all release this trigger point first, and then also we can also a little release your tendon area, some adhesions like tissues like stuck each other. We can also release that using some tools. So we can treat the muscle first, and then the tendon area we can also use some tools, metal, Graston, and then we can also use the shockwave therapy. But I'm gonna show you some self-release first, and then I'm gonna show you some treatment tools as well in physical therapy. Okay, let me show you how to self-release. So use this is lacrosse ball, little foam ball. But if you are too sensitive and too tight, then you can start with a tennis ball. Tennis ball is a little softer. So I'm gonna show you how to release the outside. Put your elbow right next to your body, and then use the ball. And then you're gonna use your squatting motion, and then you can go back and forth, up and down, and then find where is a sensitive spot. Trigger point is usually sensitive. I found it. I found here, and then I feel a little reporting sensation going down here. That's the spot. That's the trigger point. So
yeah, that's where I feel.
Yeah, so you put it right over there, and then ball is there, and then you just move a little bit up and down, back and forth. Find the spot, and then when you find it, you stay there. I don't push too hard, but my body is leaning over there. So, and I feel a little reporting sensation going down. That's the spot. So you stay there, 20-30 seconds. Too sensitive, then just a little bit less pressure. And then you stay to 20-30 seconds, and then you go back again, and then find the spot, and then stay a little bit. Yeah, once you feel better, then find another spot, and then you stay there. And then I'm gonna show you the inside, or how to release the wrist flexor. This is a little difficult, but same principle. You gotta find the spot, and then you gotta put the pressure there. So this one, the muscle is attached on the medial epicondyle going down this way. You gotta massage around here. So you stay like this. See my legs. My leg is very stable, so I can a little lean on it. Yep. And then just a little double your hand, and then just find a little sensitive spot. And then when you find a little sensitive spot, you're gonna stay there. You can arrange the ball location. I feel a little here sensitive, that must be there, and then I feel a little bit going down here, a little nervous, little referring sensation there. There must be trigger point, and that's gonna be a little nearby the ulnar nerve, nearby the nerve, and then that tightness a little squeezing the nerve. So you stay there a little bit, and then relax, and then go back, find the spot again, and then stay there. As I told you, if you're sensitive, don't put too much pressure, just a little slight, but be consistent. So I showed you how to use the ball. This time I'm gonna use how to use your own elbow to release your forearm. So put your elbow over there. I want to do a little massage on my forearm. So I'm gonna use the opposite side elbow, and then I do a little pressure, proper amount, and then I do a little go up and down. And then same thing, when you feel like a little sensitive spot, and then you stay there. You need a certain pressure, but not too much. And then stay a little bit when you find a little sensitive spot. 20-30 seconds, and then you can go another spot. You can turn, find another spot, and then when you find a little sensitive, then you can just stay over there. I feel a little tight there, so I'm gonna stay over there. So you can go just up and down, you turn, find a little sensitive spot until I feel better. Wrist flexor stretch. you can put over there, and then bring your body weight backwards. This is a wrist flexor, so from the front, going back, and you can feel the wrist flexor stretch. And then extensor, you're gonna put this way, and then you can feel the stretch your extensor. If you wanna go a little stronger stretch, you can turn, you can press, interlock your fingers, and then a little bit press there. So here, turn, and then interlock your fingers, and little body weight, then you can stretch here really nicely. The wrist extensor stretch. So I'm gonna show you how to use the instrument assistive device, little metal scraping for release your tight muscle adhesion, scar tissue. We can break it up with the metal. So we're gonna do a little muscles in your tendon area, and then the problem area is getting red. So I'm gonna apply a little wrapping around. So you feel a little discomfort, this wrist joint area, right? Mm-hmm. So I'm gonna a little scraping.
Right here.
Yeah. Here, okay. So I'm gonna a little scraping your muscles and then tendons. Yeah. It turns right away, the red, right? So that's the area you have a little tight tissue, a little tissues are stuck each other. We call it like adhesion. Yeah. Mm. So this is a little diagnostic too. So the problem area is getting more rough sensation and getting red easily. Yeah. So here's red. Mm-hmm. Mm. And here is red, but this tendon has a little tightness. Yeah. Little bit, yeah. And then your forearm, your muscles, a little red here. Yeah. Sometimes, a few times can make it worse. If you the tight area very very tight and you do it too strongly, then can make it irritated. So gotta be careful. Yeah. But when I feel this is not super tight, this can be handled by this metal scraping tool. Yeah, yeah. So definitely here. Yeah, you keep using your tendon, and then tendon has to in the inside. And then you can turn this way. Yeah, down. Yeah. This is a wrist extensor. So here is tight. Okay, good. Check. Check how you feel. Do you feel looser or sore?
It does feel looser, but it also feels sore.
Usually 1 to 2 days sore after treatment, and then it gets much better. Yeah. Okay, we're gonna use the shockwave therapy. Shockwave therapy has 2 types. One is a radial shockwave, and then the second one is a focus shockwave. This is a focus shockwave, and this is good for the tendons, ligaments, muscles, insertion area up to the bone. So focus shockwave is very very good for the ankle sprain, and then your toes and fingers. Any dysfunctional tissue you have, you're gonna feel some discomfort. So it's diagnostic too. So if you have a healthy tissue, you don't feel anything. If you have a dysfunctional tissue, you're gonna feel discomfort. So this is subjective. So you should let me know when you feel discomfort. I'm gonna start slowly. Intensity level is 2 out of 18 right now. Yeah. So let me know when you feel. Okay. So what the focus shockwave does is the problem area muscle is so tight, and then that's squeezing the blood vessel. Blood vessel is a little shrink. So this is dilate the blood vessel, releasing the muscle, and then that brings a lot of blood in, and then attracting some healing factors such as a stem cell. So it's attracting those healing factors, and then release the muscle, release the trigger points, scar tissue, adhesions. This is also release, normalize it. Yeah, and then help promoting making the new blood vessels. Yeah. So when you feel better, let me know. It can take some time if that area is a very disturbing area. Yeah, like a hip area, like back area. Oftentimes the problem area have a reverting sensation. Usually that's indicating another tight area. Yeah. But you feel another area with a reverting sensation, that's indicating that's the good spot to treat. Yeah. As I told you, the problem area you feel discomfort. The healthy area you don't feel much. Yeah. That's the diagnostic. I'm gonna move a little bit. Here?
Yeah. Gotta stop holding my phone so much.
Yeah, you just keep holding in the same position, then it's getting really tight. Yeah. So first treatment we do it, and then next treatment you feel better. Then I increase the intensity. So we just keep doing that, and then later on you don't feel much. Then it's gonna be over. So every session you're gonna feel better. You have a healthier tissue, then you don't feel much. Then we increase the intensity. So we are treating the finger, the flexors, and then the wrist flexor area, tendon area. Yeah. Okay, check how you feel.
It feels looser.
Looser, yeah. Next time we gotta treat the back.
Yeah.
But this one must be good right now. Okay, Nicole. So we treated your last time the front side, your wrist flexor. So how do you feel after treatment? That was 2 days ago, right?
Yeah.
Yes.
It feels looser. It is still a little bit sore, but I do feel more strength.
Gotcha. So let me see your strength. So a little bend your wrist. Yeah, hold it. That's pretty strong. Yeah. And turn, and then turn and up. Hold it.
Now.
Where do you feel discomfort?
Right in the middle knuckle.
Got it. Yeah. So we're gonna treat your the back side, the wrist extensors, and then your extensor finger muscles, tendons there today. Yeah. So let's begin with focused shockwave first. Yeah.
Okay.
All right. So let me know as I told you, the problem area where you have a dysfunctional tissue is you're gonna feel discomfort, and this machine is diagnostic too. Yeah.
Yes.
Let me know.
Yes.
Here. Okay.
Yes.
Yep.
Ooh.
Do you want me to go lower or bearable?
That's bearable.
Okay. Yeah, so usually you're sensitive at the point 3. That means you're a little inflamed, and then you have a little, sensitive spot. A little inflamed. Yeah. In this kind of case, it's good to massage every day by yourself. You can just put any lotion, and then giving a little massage every day, 2 or 3 minutes. Especially after using your cell phone and typing a lot, you should do stretching, and then you can do ice. No hit, ice.
I feel it in my palm, which is very interesting.
It goes deep, yeah.
Yeah.
Focus the shockwave going deep, yeah. This is it today, and then I'm gonna do some manual and then grass metal scraping. So I have this metal instrument, yeah.
Okay. Scared.
Let me see. Yeah, around the bone. Always around the bone. There's a little adhesion trigger point.
Yeah.
This one's so sensitive. Yeah.
Yeah.
Yep. There's a little trigger point there. Manually, a little pressing also release some amount of the tightness. Yeah. So around the bone, there are always a lot of adhesions and scar tissue trigger points because tendons, ligaments are attached there, and then there's a lot of tension when you're using it. Yeah. So that's creating sometimes a micro tear and inflammation. Yeah. But every day you massage, just put some lotion and massage every day. That's decreased sensitivity. So I recommend keep doing it every day. Yeah. When you massage, you can massage it soft, and also you can use a knuckle, and then you can give a little pressure. Massaging soft is good for circulation, blood circulation, lymph circulation. Yeah. And give a little pressure, then that's a little more release the deeper muscles. Yeah. And then when you find a very sore spot, then you can keep maintain pressure over there 20-30 seconds. Yeah. That helps releasing trigger points. Yeah, trigger points. And you can do several times repeat. Yeah. Until you feel better. Yeah. Okay. Let's use the tool. Yeah. The rough area is the problem area. This is rough here. Yeah.
Wow.
Okay. Your wrist extensor going all the way up to your lateral side epicondyle. Yeah. So I can release the whole muscle. It starts from you, and then it's going down there.
Yeah.
The tendon is going down and attached on your metacarpal bones. Painful?
No, it's just a different sensation.
Yeah, so when I'm using the instrument, this kind of very tight area, gotta be a little careful. If I do too strongly on that very tight area, sometimes it aggravates. But after the shockwave is loosened up, so it's much better. Yeah, I think I'm not gonna do too much. Next time I can do a little stronger. Yeah, the main area is here.
Yes.
Yeah. Okay. Let's just bring it back to your lymphatic system, back to lymphatic drainage system.
It's very cool.
Okay. Good. Check a little the movement. Yeah. Right now I cannot check your strength because it's gonna be very sore. So it's gonna take 1-2 days to heal. Yeah, and then we can check the strength.
I feel better support.
Better supporting
on this side.
Yeah, but
and both sides, but this side.
Yeah, the wrist flexor strength was good. Because we treated last time, so it's gonna be healed 1-2 days. So you can just put some heating pack. You can put some lotion, keep massaging and stretching by yourself, and then you can use the ball to release the inside the muscle. Use the tennis ball or lacrosse ball. Yeah. After treatment, drink enough warm water. Yeah. And the rest.
Okay.
Yes.
Good.
Yep.
And I'll stop gripping my phone.
Yes. That's true. That's important.